So as I said, good afternoon or good morning, everyone. My name is Suzanne Wikle. I'm a Senior Policy Analyst at the Center for Law and Social Policy. I'm going to be joined today by Jennifer Wagner, who is the Director of Eligibility and Enrollment at CBPP. She will be with us momentarily as she is resolving a technical glitch. We're very happy to have you today for this webinar that's part of the Emmy project, Applying for Medicaid 101. Emmy is a project that CBPP has launched that is really about focusing on the eligibility and enrollment experience of Medicaid and helping advocates really understand how to dig into that process, how to advocate at the administrative level for improvements in the eligibility and enrollment process to really help people navigate that process and be able to more successfully apply and stay enrolled on Medicaid. Ina, next slide, please. So today we are going to just kind of take a walkthrough of the Medicaid enrollment process. I do want to flag for you that this really is a 101 today. We are planning, as we'll talk about more at the end of the webinar today, to take deeper dives into some of these topics in future webinars. But today is really a starting point for advocates. So we really hope that this gives all the basic information that's needed out there, and then we will build upon that in future webinars. We'll also be talking a little bit today about equity and advocacy considerations as part of this work. And then at the end, we've held time for questions and discussion from you all. So as the webinar goes on, please feel free to submit questions via the Q&A box, and we will be monitoring those, and we'll address those as they come in, and then also later in the presentation. And then I just want to specify today that most of the things we'll be talking about are specific to what we call the MAGI population. If you're not familiar with that term, that's really pretty much everybody except the aged and disabled in the Medicaid population. So we're talking about parents, newly eligible adults, children, pregnant women. Most of the things that we talk about are applicable to the MAGI population. There's a few different things that are separate for what we call the non-MAGI population, which is primarily elderly and disabled, and we will note those where we need to. Next slide, please. Great. So digging in a little bit here, just kind of a visual explanation of what the process, should look like. One, somebody submits an application, they sign and submit it, verification. We'll chat a little bit about the interview, and then getting to one of the things we really want to emphasize is that under the ACA, one of the things that was changed to Medicaid is kind of what we refer to.
So sorry about that, guys. It looks like we've been having some challenges with technology today. So I will jump in and help out here. So when we talk about enrolling in Medicaid, the Affordable Care Act did envision a really streamlined, no wrong door process. And there are a lot of great options out there that are intended to actualize this process. Now, some states implement this better than others, and so we're going to go through a lot of the different options and requirements that are meant to get to that no wrong door, but there are a lot of advocacy opportunities along the way to get there. So let's go to the next slide. So as we talk about completing the application process, states are required to offer 4 different application avenues. Individuals must be able to apply for Medicaid over the phone, by mail or fax, online, or in person. And so we're going to go through some of the nuances out of each of these application avenues on the next 2 slides. But this is a really important thing for you all to look at. How many applications are submitted by each pathway in your state? Even though a state has these different mechanisms, some are better than others, and some have greater features than others that can affect how people access it, and if there really are all those different avenues to meet the different needs of people. So as we look at the next slide, let's get into the phone and mail processes a little bit. So when you're looking at applying by phone, here are some questions that are worth looking into. What are the call center hours? Are they beyond the traditional 9 to 5? Is that call center operated by the state or a vendor? In Medicaid, you can have an outside private company staffing a call center. How do they provide services in languages other than English? Do they have bilingual staff on board, or do they have to use like a translation service or an interpretation service, which may be complicated? And finally, how long do you have to wait to speak with somebody? All of these factors can affect how accessible that call center is. When we look at the paper application that some people submit, what languages is the application available in? And how long and complex is the application? Those nuances can really affect how many people are able to get all the way through the application and submit it. Moving on to the next two strategies of online and in person. For an online application, is the application mobile friendly? So if you pick it up on a phone, if you look at an application on a phone or other mobile device, are you able to actually complete it and go through the questions, or is the formatting a little bit wacky and difficult to deal with? That could be done through a mobile responsive website or through an actual mobile app that some states have. Is it easy to set up an account? Sometimes you have to set up just a username and password, but otherwise there are burdensome processes like identity proofing or a whole bunch of security questions or something that might exhaust a client before they even begin the regular application process. Can you upload verification documents along with your application, or do you need to mail them in separately? And once again, what languages are available for this format as well? For applying in person, what are the possibilities? Can an applicant go to a state or county office to apply? If so, what hours are those offices open? Do you need an appointment? And is application assistance available there, or are there just a bunch of kiosks? And if you walk in to apply, you're just directed to a computer to submit the application there rather than interacting directly with a caseworker or other helper. So looking at completing the application and some other avenues for the application process on the next slide. You know, we did talk about this idea of no wrong door, that people should be able to apply for Medicaid from any avenue. So states must use a single streamlined application, that's a CMS term, for the application or an improved alternative. And that's meant to make sure that you can apply for all healthcare programs at once. We call that vertical integration, so that you could apply for Medicaid as well as premium tax credits and other programs for people of higher income. So that's what the Medicaid application often looks like, but there's some variations on this as we're looking at here. People can also apply through the marketplace, and that could be through healthcare.gov, the FFM, or through a state-based marketplace. And while that's normally geared towards higher income individuals, it is necessary that those marketplaces screen for Medicaid eligibility first. And if they determine that somebody is likely Medicaid eligible, they transfer that application over to the state Medicaid system for processing. That's part of this no wrong door theory, that no matter where you go, you end up in the right place. Now, as many of you out there on the front lines know, that transfer process can be fraught with errors. For one thing, people apply to this federal healthcare.gov, but then they might receive a notice from a state Medicaid or Health and Human Service agency, and that can be kind of confusing. Sometimes there are issues with the actual transfer of information to the state. Sometimes it gets into a backlog and isn't always worked. So there's another area to explore to see how that process works in your state if somebody applies through the FFM, but then is sent over to the Medicaid system. Now, some states also have Medicaid as part of a combined application. This allows an individual to apply for Medicaid, SNAP, cash, and even other programs together. Unfortunately, with the advent of the ACA, a lot of states did split off Medicaid and made a Medicaid-only application. So in those situations, it's important to consider how individuals who are applying for Medicaid and are likely eligible for other programs like SNAP and cash are referred to those programs, how those applications are pre-populated, or other strategies to make sure that people are enrolled in a full package of benefits for which they're eligible and what's needed to support their family. Finally, another application avenue is presumptive eligibility. And this is usually done through a healthcare provider, although especially during COVID, a lot of states have expanded the number of presumptive eligibility entities that can be used. And this is kind of a provisional Medicaid eligibility, where you're enrolled by that provider, and then you have to submit a full application to the state agency later on. So these are all different avenues to enroll in Medicaid. So looking at the next step of actually signing and submitting the application. This is something that's pretty straightforward if you're in an office or dealing directly with a caseworker, where you just do a physical signature and hand in the paper. But with these other avenues, particularly over the phone and online, there are a few nuances to be aware of. So if you're applying to the state through the phone call center, then they should be able to capture a telephonic signature, which is where the state agency or their vendor makes a recording of the telephonic signature. And that completes the application process. No paperwork or anything else is necessary. Now, some states still might require a wet signature on a mailed paper form. So you call in and you give them all your information, but then they have to send you something for you to sign and send back to kind of complete the application. And this is burdensome. It delays access to care and introduces a lot of potential for error if the client doesn't get the paper form, isn't able to send it back, or the state doesn't process it. So most states are able to capture the telephonic signature, but definitely something worth checking on and making sure is the case in your state. A lot of people also apply through community partners. And previously, this was done in a very in-person, face-to-face type way. Obviously, another thing that has changed in this COVID area that we're living in. So sometimes the assisters help applicants over the phone. And the question is, how does that assister actually submit the application on behalf of the person over the phone? In most cases, they haven't interacted with this person before and don't have a signed document or an approved representative form or anything in place. And so in that case, if you're applying to healthcare.gov, many of you are navigators and assisters and more familiar with that avenue. There's a process you can use for that. But it gets a little bit trickier when you're looking at a state Medicaid application. So what you can do there is the applicant, the client on the phone, can designate the assister as a limited authorized representative for purposes of submitting the application. And that allows the assister to submit the application through the state Medicaid application on behalf of the applicant. So that's a good avenue right now. It has a few complications, and unfortunately, this authority is tied to COVID. And so it's something that we're looking at is what some options are in the future, because normal issues like transportation, time and hours can limit access to in-person assistance, but also the lingering effects of COVID will obviously last for a long time and prevent some people from interacting in person. So that's a little bit about the kind of signing and submitting aspect of applying for benefits. The next step is verifying. A Medicaid agency has to verify a certain number of eligibility factors. And what we've got listed here on the slide are things from MAGI applications. It's slightly different for non-MAGI, for that elderly and disabled category. But for MAGI, the Medicaid agency is required to verify things like income, residency, age, citizenship. All these things have to be verified, but there are different ways that it can be done. And I want you to pay special attention to those with the asterisk, which are focused on things that require verification beyond self-attestation. So let's look at the next slide and how information is verified. The simplest thing is self-attestation. Many of those factors that were previously listed can be included on a signed application. That's self-attestation from the client, and that's valid. No further information is required. But for those things, especially with the asterisk, again, those were income, social security number, and citizenship or immigration status. There, the state does need to verify those things. Fortunately, there are a lot of electronic data sources that can be used for verification. For immigration and citizenship status, there are things through the Department of Homeland Security and through SAVE that can verify it for many clients. For income, states primarily use two things. One is the work number, and one is state quarterly wage data. And these will often give a picture of a client's income and can verify that they're income eligible. For those of you who deal more with healthcare.gov and higher income individuals, they often use IRS data to verify income. That's much less applicable in the Medicaid context because Medicaid clients tend to have a lot more variable income, and IRS or income tax data is less relevant to their Medicaid eligibility. So the last option is for the applicant to actually provide documents. That's if self-attestation is not accepted and the state is not able to verify eligibility through those electronic sources. So in that case, an applicant must provide verification documents. Could be a pay stub, could be some immigration-related document. So at that point, you want to ask, how can the applicant submit the document? Does it have to be mailed in or dropped off? Or are there good avenues like applying, like submitting the document through an online portal, or even taking a picture with your phone and submitting it that way? So the next thing with verifications I want to flag is this policy called reasonable compatibility. And this is a policy that really should streamline the application and verification process for a lot of clients. So under reasonable compatibility, a client statement and the data source do not have to be an exact match. The good thing about Medicaid eligibility is it's primarily on or off. It doesn't really matter for most clients if your income is at 10% of the poverty level or 110% of the poverty level. You're still eligible for the same package of benefits. So if the difference between what a client puts on their application and what the data source shows, if that difference doesn't affect eligibility, then no further verification should be needed. Now, this is a tricky policy, and a lot of states don't take full advantage of it and request too many documents from clients. And that's why I'm flagging it and want to go through a quick example on the next slide. There are lots of different nuances to this, and we probably get into that into a future webinar. But right now, here's an example. So let's say you're applying for a family of 3, and the eligibility threshold is $24.98 per month. In the first example, a client puts on their application that they earn $800 a month. But the work number, the state's electronic data source, shows $1,600 a month in income. That's a pretty big difference. One is double the other. But the key here is that both of those numbers are below the eligibility threshold. So the difference doesn't affect eligibility. The family's eligible either way. And so therefore, those numbers are reasonably compatible and no additional verification is required. Now, looking at the second example, let's say that again, the client statement on the application is $800 a month in income. But here, the state's quarterly wage data source shows $3,400 a month, which is actually over the eligibility threshold for this family. In this case, the client attestation is below the eligibility threshold, but the data source is above. And here they are not reasonably compatible, and additional verification is going to be required. And that could be a client statement, that could be a paper document. Again, to be clear, it doesn't mean the client's not eligible. Perhaps they lost their job, and that's not reflected in the quarterly wage data, or something like that. And a client could explain it, could provide verification, and still be eligible. But it's something where some step will be necessary, and usually the state will have to reach out, and the client will have to provide a statement or other documentation. So next, we'll move on to interviews, and I want to check if Suzanne's back with us and able to take over.
I think I am. Are you able to hear me?
Yes, great. Welcome back.
Okay, great. Sorry about that. And thanks, Jen, for picking up there for me. Talking about interviews. So back in the day, some of you may remember that all or most Medicaid applicants needed to complete an interview as part of their application before they could be enrolled. And one of the really great things about the ACA was moving Medicaid away from interviews, and specifically that states can't require in-person interviews for Medicaid. We have heard a little bit of rumbling out there about possible phone interviews happening in some places, which are not particularly necessary for the MAGI population across the board. And so we certainly, if you think that's happening in your state, would be really interested to hear about that from you. And then very importantly, when it comes to interviews, there are interviews required for other programs like SNAP and TANF. If somebody completes a combined application for all of these programs, but they fail to complete the interview for SNAP or TANF, that should not affect their Medicaid application moving forward and going through the review process and the verification process. And we have heard of that happening sometimes, so that's something to definitely look out for in your state, especially if you think a lot of people are submitting those combined applications. Next slide, please. So then after we get through the verification step that Jen really went over, then we're really at the eligibility decision and seeing whether people are able to be enrolled in Medicaid. And there's a few different ways that we kind of talk about this happening, but the bottom line is that states are, for the most part, required to do an eligibility decision within 45 days. Obviously, we hope that it's in a much shorter time frame than that, but that is the time frame that they are given. A lot of states are able to do what's called real-time eligibility. This is where it kind of happens in real time, which is defined as within 24 hours of the application being submitted, when all of those things, the verifications can be done electronically, and there's no need for follow-up information. And that's really ideal, and that's what we like to see. Some agencies may approve an application and then request verification documents kind of on the back end, and we call that post-enrollment verification. And then also, some some agencies may just delay the eligibility decision at all until they receive any additional verification documents that they've requested. It's important to note that if your application is only lacking the verification around citizenship or immigration status, that applicant should be given 90 days to provide verification, and they should be enrolled during that period. One of the resources we're going to provide at the end of this, and we will send out slides to everyone, is a federal report of state timeliness. So you will kind of be able to see how your state is doing and how it compares to other states. All right, next slide, please. So then moving into a little bit of like, okay, so that's a broad overview of the process, of what typically happens, of all the different places where there's interaction between an applicant and an agency. But we know that it doesn't always work totally smoothly, and that there are a lot of things, especially from an equity consideration, that should be taken into effect. So, I think it's really important as advocates, when we think about the application process, to think about how different population groups navigate that and where they hit different barriers. So, for example, people with multiple jobs may have greater barriers than others around proving income and having to submit multiple documentations, or really kind of explaining how all of their income fits together. Immigrants obviously have more verification that they need to provide. So really thinking about how the different steps are easier or more difficult based on kind of somebody's identity. And then how are we keeping track of that? It can be really difficult as advocates to understand exactly what the barriers are, let alone kind of how they vary between different population groups. But I think the more we can think about, denial codes from states and kind of what those look like, if those are able to be broken down by race and ethnicity, or if there's a way we can partner with community organizations who are helping people enroll, to kind of get a better sense of how those barriers are affecting people and how we can keep track of that. Next, I think there's a question about, sometimes there's a policy solution to barriers, and sometimes it's an operational question. So, maybe a policy is spot on, but the caseworkers are not implementing it correctly, or perhaps the policy is wrong, and that's the ultimate problem. So I think we need to look at it from both angles to really see what the solution could be. Next slide, please. And then again, is the state really asking for things that they don't need to ask for, especially when you go back to Jen's description of reasonable compatibility? Are they sometimes asking for income verification when they don't need to? And again, is that a policy issue, or is that an operational issue because maybe they're perhaps just interpreting the policy incorrectly? If we look at some of this data or access issues by office or region across your state, how do those vary? How are different languages accommodated? How are requests for verifications even sent out to people? Are they only snail mailed? Are they also emailed? How are people receiving those requests? And then obviously a huge one is how COVID is affecting all of this. It's completely changed how many states are operating their programs, with their state staff being remote and not having in-office assistance for people. And what groups of people is that really creating additional barriers for during this time of the pandemic? And Jen, I'll hand it back to you.
Great, thanks, Suzanne. So we've given you lots of questions and things to consider in your state. But one of the challenges is, how do you gather this information? It's not something that's written down clearly in a place for advocates to go and look. So one thing to do is to just poke around. Call the call center. What is the phone tree message like? How long do you have to wait? How long until you actually are connected with a live person, or can you? Try the online application. Set up a dummy account and go through. Don't submit it. That'll throw your agency off. But just kind of walk through it and see, is it pretty friendly? Does it make sense? How long does it take to actually get through it? The next suggestion is obviously more effective in different times than we live in right now, but visit an office. Ideally, if you can go with somebody who's applying and kind of shadow their process, or just sit in a waiting room and see how busy it is. How many people are waiting there for many hours? What kind of paper, applications are available? What kind of signage is there? Wherever possible, it's important to build relationships with people who do interact directly with Medicaid individuals, if you're from an organization where you don't do that directly. So build relationships with caseworkers that you connect with over a case, over sharing resources in your community, whatever it might be. And then with people who are providing direct service, like navigators or assisters. It's fascinating to know what barriers they're encountering. They tend to see a large volume of clients and can identify where people are struggling to complete the process or where there's opportunity for improvement. And then you can really kind of dig into policy manuals and memos. As we've said, policy is only one level. How it's actually operationalized and what the technology does to implement that policy is another thing to look at. But you can start out by seeing, what does the policy manual say as far as verifying eligibility and things like that. Memos are often from state leadership to caseworkers on the ground. What's being communicated to them? What are the priorities of the state right now? And is it oriented towards access or towards program integrity or cracking down on certain things? That can give you a good feel for what's happening in the state. And something we didn't include on the slide, but is very relevant to most of these factors, is data. Request data from your state on how people are applying, on what the approval rates are for individuals. Whatever you're able to get from them can be very informative. The goal here is to understand the process from the beginning to the end from both the applicant and state's perspective. So what is it like for an individual applying? Once they submit an application, what kind of notices do they get? How long does that take? What are they hearing back from the state? And then from the state's perspective, sometimes when an application is submitted, it might feel like it goes into a black box and you're not sure what's happening, and the client may get an approval letter, may get a denial, may not hear, and it's hard to know. So by doing some of this investigation, you can better understand what's happening on the state's end and where there are opportunities for improvement. So you want to know how people are applying in your state. That's something that ideally you would be able to look at pre-pandemic and currently, since that has likely shifted greatly in the past few months. And to identify where in the process people are running into barriers. Is it finding out about Medicaid eligibility? Is it submitting the application? Is it the verification documents? There are a lot of different places, and that can kind of guide your advocacy to what needs to be tackled first. Next slide. So, with Medicaid eligibility as well as other programs, there's not a checkbox. It's not a checklist of, if you have these policies in place, you're going to have a well-administered program. So it's important to take a step higher and look at the goals. What are you trying to achieve? In some states, the main challenge may be access for all populations, rural populations, or immigrants, or a particular ethnicity, low-wage workers, whatever, may be having trouble accessing. And so your goal is to make some changes to the program to accommodate the unique needs of these different groups. Your goal might be to reduce procedural denials. A lot of people apply, but then the state asks for too many documents, or something happens that eligible people aren't able to actually enroll. And so that's the area that you're tackling. Or it's a matter of improving customer service. People are able to get on, but they have to apply multiple times, submit documents, call over and over to check the status, and they eventually get enrolled, but it's a very painful process, and some people fall off during that journey. So that will help you kind of figure out what policies will lead to those goals. And again, there's not a set number of policies. If a state is getting access to all populations, but they don't have real-time eligibility, okay. It's whatever they're doing to achieve those goals. Lots of different approaches that are possible. Another strategy is to really use some sort of a framework to build support. And so this might be focusing on children or seniors or rural population. You might have a governor or administration that's really focused on one population, and you can use that as an angle to get improvements to the program that likely will benefit all populations. You can also look at different themes and what might resonate with your state. I know that for many of you, access is not something that's going to get your foot in the door. That is not something that's going to really resonate with your legislature, your governor's office, whatever it might be. But modernization might, or talking about efficiency or customer service. These are other kind of entry points to a lot of these streamlining techniques that might be a little bit more applicable in your state. So the last slide here we've got is a number of resources for you. And again, I want to encourage you once again to submit questions through the Q&A box on Zoom, and we will get to those momentarily. So we have the ME website. Again, this is part of elevating the Medicaid enrollment experience, and our website has lots of great papers and presentations from our organizations and others related to eligibility and enrollment issues. We also have the state verification plans here, which is on the CMS, the Medicaid.gov website. And that's a great place to look to see how your state is verifying Medicaid eligibility. It's something that they had to submit with ACA implementation and talks about where they accept self-attestation, where they might do post-enrollment verification. I also want to flag that some states have verification plan addendums related to COVID. So they've changed some of their policies in light of the health crisis and are doing some different things right now, which is important to be aware of. There's also a link to the Kaiser 50-state survey, which really examines a lot of these different state options, and you can see how your state is implementing different possibilities and how they compare it to others. The federal regulations, of course, have lots of important information about what's actually required of a state. And finally, there's state processing timeliness available on the CMS website. The data lags quite a bit. It's, I believe, from last year. It's very much pre-COVID, but you can see how many applications in your state are processed in real time in 7 or 10 days. How many of them take greater than 45 days to process, and gives you a little bit of a vision of what's happening. And again, we'll be sending out these slides and a recording later on where you can access these links. Also encourage you to watch for upcoming ME webinars as we dive deeper into some of these issues in applying for Medicaid 201 next year, as well as a 101 and a 201 series related to Medicaid renewals. And with that, let's open it up for questions.
Thanks, Jen. We do have a couple questions that came in. Do you have recommendations on best practices to improve data collection on applicants' race and ethnicity? We aren't able to get health outcome data disaggregated by race ethnicity because this data is missing in about 30% of applications. The question asker also says they want to be sensitive to the fact that some applicants may be reluctant to share this information.
That's a great question, and that's a really tough thing. We talk a lot about, disaggregating by race and ethnicity, which is important, but that's reliant on having strong underlying data. So that's one of those where you would want to kind of tackle the process of how a client is assigned a certain race or ethnicity. Is it on the application? And is a client encouraged to answer that question? Are the different options appropriate? Sometimes these applications haven't been updated for quite a while, and so that question might be based on some kind of older constructs. Is it up to the caseworker to enter this information? Is it based on their visual assessment of the person in front of them, or do they ask the question? What happens if somebody's applying over the phone and doesn't answer that question? So if you're really going to get at the underlying data, one of the big things there is to make it a priority, to have the administration say and communicate all the way down to caseworkers. We need accurate information on this. Do not select other unless the client declines to provide information. We need to modify the application so that the questions are appropriate and that people are encouraged, though not mandated, to answer those different things. So that's definitely kind of a long game approach and doesn't turn around and get you accurate data right away. But you've really got to kind of get the state to clean up that underlying information. And from there, you'll be able to get information about the application and the renewal process, utilization, and all of those other things that flow.
And I'll just add to that. This is Suzanne. That I think sometimes we hear states are hesitant to publish data like this because they don't feel like it's accurate enough or they have enough people answering that question. But I think if you have a friendly administration that's willing to kind of pull some of that data, even if they're not comfortable publishing it, it could still give you some ideas about what's happening and lead you down some other paths and questions to ask your state.
Great. Our next data question is, how can advocates find data on metrics such as the method of how applications are submitted to their state, including phone, mail, in person, and other pertinent application and enrollment data?
The answer to that is kind of the formal and the informal data. So the informal data is just talking to people. Looking at navigators and assisters and other community partners who might submit a large volume of applications, talking to clients and seeing what their experiences are. Hey, there is this online application. Does anybody use it? People might say, oh no, I can never set up an account or it never works for me. Then the next step is to really go to the agency and ask for reports on this. In many cases, the state may have access to those reports and be reviewing it, and you could just request it. Or in some cases, they might have to get the system to generate it, which can take longer and be a little bit more challenging. So there are, of course, more aggressive techniques if needed, like a FOIA, a Freedom of Information Act request, or you could also go through a media partner and ask them to ask for that information, or a legislative panel or a legislator that you're familiar with to have them request the data. And sometimes that can prompt the agency to generate it and release it, and might not kind of blow back to you that you're the one harassing the agency. So it's a big battle sometimes in some states, but it's definitely worth pursuing. I also encourage you not to wait until you get data to take action. It should be a path that's kind of parallel with other efforts. So for example, if you know that the online application is really difficult to use, it requires remote identity proofing and answering a bunch of credit questions, and nobody really can use it, don't spend 6 or 9 months waiting to find out that 5% of people are applying through the online application. Request that data, pursue it, but in parallel with that, identify the problems and the obstacles to the online application, and try to push people to make improvements as you're waiting for the data.
We had a couple questions come in regarding assisting people with submitting remote applications. In Colorado, they have not had success in getting their Medicaid agency to create guidance to allow for remote enrollment assistance. What suggestions do you have to address this?
We'd be happy to work with you individually on that, so please reach out because it'd be great to know exactly what the circumstances are. But as we referred in the presentation, there is some CMS guidance on this, and it's contained in some of the COVID frequently asked questions that CMS has provided. And it does say that a client can designate that assister as a limited authorized representative, allowing them to submit the application through the website. We know that some state rules are getting in the way of that being effective. And also there's some complications that some navigator and assister funding doesn't allow you to be an authorized representative of any sort for a client. And so it's definitely an imperfect solution, but there's some ways around it. And hopefully there's an opportunity to get your state to figure out something. This is a unique crisis, and per recommendations, people should not be interacting face to face here. And it's really important to find a solution. And the other thing is to direct a client to apply directly with a state. I know that bypasses the valuable assistance that a community partner can provide, but hopefully that would be an avenue to at least get the application submitted and on file, and then a sister could help through the rest of the process if needed.
The next question is, our state has so far refused to implement a single application and routinely rejects folks who use the wrong application. For example, an ABD applicant who got confused and used the MAGI application. No outreach is done to these applicants to encourage them to apply using the right application. They just receive a rejection with no information. What are options for advocates to challenge these practices?
That's a great point. We do talk about a single streamlined application, but that doesn't necessarily cover non-MAGI. It's designed to flag elderly and disabled, but it doesn't really collect all the information that's necessary for that determination. So, a couple options are publicizing more clearly which application is for which program, but really it's important that the state does follow up. If somebody applies and use the wrong application, it is an obligation of the state to reach back out for the correct information. There are very clear regulations that when an application is submitted, the state must consider them for all possible categories. And if the MAGI application didn't capture things like resources that are needed to make a non-MAGI determination, the state needs to reach back out and request that information. So it's kind of a combination of educating people about which application to use, but also working with the state to make sure that they follow up on the appropriate ones. Unfortunately, there's a limited number of states that actually have a full comprehensive Medicaid application that covers MAGI and non-MAGI. So that's a problem in a lot of places, similar to the problems of making sure people enroll in SNAP and WIC and other things. So there's some technology and other solutions that should be able to improve that.
The next question is, if you wanted to get a sense of how healthy a state's Medicaid system is at a glance, what are 2 to 3 key outcomes or data points that you would look at first?
Great question. I would tend to focus on procedural denials. Again, this is assuming you have access to this data from the state. But a procedural denial is when somebody's denied not because they're found ineligible, but because they didn't do something in the process. Because in a couple of those states, because they didn't complete an interview, or because they didn't submit a requested piece of documentation. And that to me would signal whether there's a policy issue where they're requiring too many verification documents, whether it's an operational issue or a technological issue where people aren't able to submit things as necessary. So that's one aspect, and kind of a related aspect is churn. And churn is often talked about in the renewal context, where somebody's enrolled, they don't renew, and then they have to reapply a few months later. There's also kind of an application churn, where somebody applies and is denied, but then reapplies and is able to enroll. So that really generally suggests that the application denial on the first application denial was not appropriate, or something went wrong in the process because the person was eligible but wasn't able to complete the process. So those are two big factors that signify kind of the overall health of the process. That is limited to people who actually apply. I think there's a whole other set of data to really investigate who's eligible. How did they find out about the program? Were they discouraged from applying? Did they not think that Medicaid was right for them? That's something that we're seeing a lot right now in the current recession, that people who have lost their jobs don't think they're eligible for Medicaid, or think because they had income previously this year that they won't be eligible, not recognizing that their eligibility is based on monthly, not yearly income. So that's probably more than 2 or 3, but there are a lot of different things to look at in the process.
And for states that are just beginning to expand Medicaid, what are some of the challenges they may face, and how can advocates and community partners best support the change?
Great question, and I hope you're in one of those exciting states that's working on these issues. So, I would start at the state level. There are a number of things that the state can do to expedite enrollment for, the population that they have some contact with and they know are eligible. So for example, the state might have people enrolled in like a family planning program that's not full Medicaid, but provides access to some services. The state should be able to convert those individuals to regular Medicaid when expansion takes effect. Similarly, they can draw on people enrolled in SNAP or other programs that are very likely eligible for Medicaid. And through a very expedited process, they can get those folks into Medicaid. If that's set up well ahead of time, then you really decrease the volume of applications that you're going to get when the applications open up. So that's a way to streamline a lot of people in upfront. And then when you look at opening up the application process, it's a matter of doing a lot of the things that we discussed in this webinar, of making it easy for people to apply, minimizing verifications, having strong communications with individuals. That will expedite the enrollment process for the newly eligible, as well as the overall population, and hopefully not lead to backlogs and other problems. I think the other aspect is relying heavily on community partners, making sure that they're helping to get the word out, making sure they understand the policy. When can people apply? When will coverage be affected? How are certain populations affected by this transition? And that will really kind of expand the state's reach and have a whole set of people out there in the community providing accurate information and helping people make the right decision, and those that are eligible enroll.
And our next question is about churn. How would you frame a request for data to identify that churn is an issue? We believe that this is an issue in New Hampshire, and it would be helpful for to get data to back this up. I know that it might depend on the state system, but would you ask for the number of people who were approved for coverage within a certain period of time after losing coverage, or receiving an application denial?
Another great question. So there's a really great paper by my colleague Dottie Rosenbaum. It's called Lessons Churned, very cute. But it really goes through how you might measure churn in a health and human service situation. And there are a couple of different options. You can look at all the people who lose benefits at renewal. Out of those, how many come back within 1, 2, 3 months? You can look at application volume and what percentage of those applications were enrolled 30, 60, 90 days previously. There are different ways of measuring. It's not something that's standardized, and that's fine. whatever the state can most easily measure. And there isn't necessarily a standard also for what is good. Is 40% churn good, 20%, 60? What are you looking at? I think the key there is to improve it. Pick a way to measure it, have it measured consistently month over month, and then make some changes and see how that affects the churn, however it's measured. So it can be difficult for a state to do this measurement. Many haven't been doing this for many years. It's not required at the federal level at this point. And so it's really a matter of working with them and understanding their system and what is the best way to measure it. Again, not a set perfect way of doing it. Find a way to measure it, keep measuring it, and try to make improvements to that process over time.
And when looking to advocate for some of these positive changes to the Medicaid enrollment process, who are the key decision makers that advocates should build relationships with in their state?
So there are a variety. I mean, you kind of look to the Medicaid director as a person that is important in influencing these decisions. And that's a good place to start. However, in many states, the Medicaid director is a little bit more focused on managed care or utilization and some of those kind of back-end things after somebody's enrolled. So there may be somebody under her or related that's more focused on kind of the eligibility and enrollment parts. It depends on your state situation too. If you have a friendly administration, if you have a governor who's prioritizing health coverage or has a particularly focus on a population like children, like veterans, homeless, substance use disorder, whatever it is, you might be able to kind of go in through that avenue and emphasize the way that Medicaid access can further those goals. And then you can have kind of a top-down message from the governor's office to folks in the Medicaid agency saying, hey, listen to these people, Medicaid access is really important to my goal, let's make some of those improvements. But one of the things that can be really effective is going a little bit lower than that, is going to the career staff that are making some of these decisions or that are overseeing local offices or the eligibility workers making these decisions and talking to them. The good news is a lot of things related to streamlining benefits is beneficial for the state too. Very few state agencies have enough workers, so they're often overwhelmed. And if you point out something that they can do where they don't have to verify or get paper documentation from a client, they can utilize an electronic data source. That's an important thing for them too, because that might mean they can process things more quickly, save caseworker time, be more timely, get fewer customer complaints, things like that. So if you make a connection at that level, that's an important place where you can really learn about their priorities. Is it a combined system and they're really under a lot of pressure for SNAP? And so if I can just get the Medicaid applications processed more quickly, I can focus on that. Are they worried about loss of staff right now due to budget cuts, due to people being out on health leave, challenges associated with remote work? And is that an avenue for, hey, here's a strategy that you might have implemented temporarily during COVID-19, but look how well it worked. Let's see if we can make that permanent so that you have, continued workload relief going forward. So those career staff are often very receptive to things like this if they're framed in the right way. And then you need support from above to make sure it happens, especially if it requires a state plan amendment or something like that. But they can sometimes advocate for it and frame it in a way that really shows the benefit to the state as well as the client.
Great, thank you, Jen, and thank you, Suzanne. There are no other questions.
Great. Well, thank you all so much for joining us today. Please do follow up. Our contact information is on the screen. If you have any additional questions or we can help you dive into some things in your state, please reach out. And if you're not already, sign up for our Emmy listserv, and we'll be sure to get back in touch with you with a copy of today's recording, as well as let you know about future webinars that are coming up. So thank you so much. Have a great day, everybody. Stay safe.